after I spoke to Lieutenant Durvin, a very nice lady, Lieutenant Durvin, I think it's D-E-R-O-V-A-N. I know that she notified the warden, and lo and behold, one of the water fountains up in that lovely waiting room is working. Now, of course, the story I get is, well, we can fix it, but somebody will just break it again. So, I don't know what exactly the answer is to that. Seems to be enough of, well, of course you use it for maintenance, but there should be enough people around to visit these water fountains and the restrooms. Oh boy. And then I want to speak about GTL, Global Telelink. Boy, you really have spiked through with GTL. You really have. You put money on that account so that your person who's in the jail can call home, collect. I've been cut off so many times, and that is money that's wasted because GTL gives no refunds. They take no responsibility for you being cut off. None whatsoever. And it's expensive, and they charge a fee for this wonderful service that you're getting. Also, I don't know who arranged for the commissaries for the people in the jail, but you put money deposits in this little kiosk in the waiting room, aside from the jail people. Any money that you put in there up to, I believe it's $25, requires a fee of $3.95. If you put in an amount over that, it requires a fee of $5.95. How much more work do they have to do to write down $5.95 than they have to write down $3.95? Why do they have to do that? Anybody? Mr. Brown doesn't seem to have any ideas about this.
Well, you got a few, right? Believe me, I know. You're asking why the escalation in cost when you deposit more funds into the commissary account to pay for items that the prisoner would use in their normal.
And the prices at the commissary are not low.
Right.
Well, it's not Fort Dix either.
No.
I mean, it's not the commissary out there. That's a convenience for the prisoners and the inmates.
Well, that's fine. That's fine. I'm just wondering why there's a fee of $5.95 if you put more money down than there is.
Mrs. Reed, I honestly, I'm going to say this, I wish we didn't have prisons or jails.
Oh, me too.
Honestly. To be truthful. But that we require it, and it's very expensive. It's one of the biggest costs in the county government today. And the county taxpayer pays it directly without any compensation or reimbursement, other than maybe state and prisoner reimbursement. So it's a very heavy cost that we lay to house our inmates and people who are violating crimes. I understand that your grandson may not be comfortable in our facility, but it's a place of correction, or action. And understand what I'm trying to tell you in the nicest possible way. I will look at these issues, as far as the phone service, I will look into it. I'm glad you got your personal effects, but I will also tell you that our prison system here is probably run very well. There are some things that have to be taken care of. We, as a freeholder board, have recognized that, and we bonded for it, and we are doing these things. grandson's situation. I don't know what he did or what happened. I really don't, I mean, I do care, but I'm not gonna create policy around one individual, or this board is never gonna create policy around one inmate. But
You haven't been asked to do this for one individual. I'm concerned about all those residents in Burlington County Jail. I'm concerned about any of those guys that are sleeping on the floor.
and
I'm concerned about any of those guys whose families are spending so much money to have telephone contact with these fellows.
Ma'am, I'm concerned about the 450,000 residents that are paying to house these inmates and prisoners. Bear that in mind.
Excuse me?
I'm concerned about the 450,000 residents of this county that are paying the cost to house these prisoners and inmates.
Well, Mr. Brown, get back to you. I'm not an idiot.
no, and I'm not treating.
Camden County has a jail, far worse than Burlington, I know. Mercer County has a jail. Atlantic City County has a jail. Wildwood County, well, that's not Wildwood.
Keep it.
There's jails all over, and there are citizens, residents, paying taxes which cover building such things. Is that not true?
That's correct.
Yes.
And if, you know what, if you ask taxpayers what's the last thing they want to pay for, you know what it is? Corrections. They don't want to be in that business. They want to pay for law enforcement. They want to pay
Well, I
for
don't know about
parks.
that. Lumberton's getting rid of their...
Well, I mean, I know, you kind of have a bias towards law enforcement in general, I think. But the reality of it is, that's what folks want to pay for. They want safe communities, they want their children well educated, they want safe park areas. So, really, corrections isn't number one on our list, and they say, well, that's the thing I want my dollars allocated, my tax dollars.
But if they were to read of conditions in there, there's more than a few people who would say this isn't right. We need to do something about it. They're not all just sitting around dumb and blind and deaf.
And I think, Mr. Street, we'll turn around, and I think Freeholder Brown said, maybe take a look at some of those items, your thought ideas, and that's the reason we have the public portion of these meetings. You know, I think what you have to know, though, it is a prison. It's not the Holiday Inn, and it's not a great place to be. I mean, and it's a shame. I mean, it's a shame people have to go there, but at this point, you're right. If there's something there that we can adjust to make it better, and it's not something that is going to be detrimental to the taxpayers of Burlington
Or
County,
staff,
or security, or people's health and welfare, we'll take a look at that. I mean, we're not being hard. We're trying to do the best job, and those folks are over there. It's a very difficult job. Very difficult job. So, we're more than willing to take a look at those items.
They are.
Yep.
They are. And I wish you could hire from a different category of people, more educated perhaps.
That's your opinion.
And I'm entitled to it.
Yes, you are. Here you are, and so am I. And to say that about a workforce that is protecting the public against individuals.
You really haven't been over there for a long time.
Ma'am, I've been over there, I've inspected, I've provided reports of things that had to be done over there. So I would just tell you, I think your comments are off base.
Anything else?
Now, what comments are they?
Well,
Criticizing the ability of the
when
people
you
who
call
work there?
individuals a different class of people or more intelligent, those aren't kind comments. Those are angry comments. And and honestly, personally, it's not welcome by me. And you had the right to say what you had, but I also have the right to tell you it wasn't welcome.
And you know what else right I have is to tell you I don't care.
Best part about this country.
Yes, it is. Gentlemen, I'm through.
And lady.
And lady. Lady.
Thank you, ma'am.
This is mine.
Oh, actually, we never got our, no. Anyone else? Seeing none, we have no press, we move on to freeholder comments. Freeholder Reinhardt?
I just wanted to say what a great job that Buttonwood Hospital did once again. The state came in and did their survey and inspection, and they got great grades for what they're doing out there. And they only written up for one issue, and that was the water temperature in one of the rooms didn't meet the standards. So I just wanted to commend Eve once truly rise to the occasion on all the reports. And I know that we have the New Jersey reports the first human case of West Nile virus, and I just would like to know, because I'm not involved with the health department anymore, but perhaps if they could get into the crustacean program to control the mosquitoes. It's a very successful program. I have the information here if you're looking at it. And instead of always treating everything with chemicals, particularly in those wetlanded areas, I think it would be a great measure for the environment. Also, I'm not aware of what anyone knows about the state overhaul of the prevention program, and I just want to know, if you do know anything about it, how it's going to affect our post-house program. Do you know anything about that? Bruce?
Not offhand at this point. I would imagine that our administration would take a look